Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. And today in this video, we're going to be talking about cold sores. We'll talk about prevention, goals of therapy, non-pharmacologic therapy, as well as pharmacologic therapy as it pertains to cold sores. Now, before I start this episode, just keep in mind that this information is for information purposes only and not to be used as a source for recommendations for your personal health care. I put together some slides to go over this information, so let's just jump right into it. So the first thing to go over here would be the pathophysiology. So the development of cold sores is primarily related to two herpes simplex viruses, or HSVs, which would be herpes simplex-1 and herpes simplex-2. HSV-1, which is most commonly transmitted via saliva, causes the majority of oral herpes infections. HSV-2, which is present in genital secretions, causes the majority of genital herpes infections. Orogenital contact may cause a primary infection of either type in either the oral or the genital region. And 20 to 40% of patients who experience a primary herpes infection develop subsequent recurrent herpes infections. Now, if a patient is having their cold sores assessed, there would be further evaluation required after the assessment if the lesion was present for greater than 14 days, if the lesion appears excessively red, swollen, or contains pus. Patient has symptoms of systemic illness, for example, fever or swollen glands, history of lesions occurring greater than 6 times per year, or if the patient has a health condition that compromises their immune system. When treating a cold sore, the goals of therapy would be to reduce any discomfort, including pain or itching, reduce viral shedding, reduce duration and severity of the episode, prevent secondary bacterial infections, and prevent recurrences. In terms of prevention, common stressors that can precipitate recurrences include emotional stress, dental extraction, fatigue, fever, hormonal factors, hyperthermia, menstruation, physical trauma or surgery, sun exposure or UV light, and upper respiratory infections. Consider the following measures. Reducing stress, so eating well, getting enough sleep and exercise, and relaxation would be helpful. Prophylactic treatment with an antiviral prior to dental procedures may be used for some individuals. And it's also good to protect affected area from sun exposure, so use sunscreen with SPF 30 or higher. We'll now discuss non-pharmacologic therapy. So patients should be advised to keep the lesions clean with gentle washing using mild soap and water. Alternatively, the area can be soaked with cool tap water compresses. Patients should avoid excessive touching of the lesion and should wash their hands frequently to prevent auto-inoculation and spread HSV. Heat application is a treatment yet to be evaluated through randomized research. Devices in the shape of a lipstick have been marketed for use on areas where prodromal symptoms are felt. It is thought that the high temperature may reduce severity of symptoms such as burning, blistering, itching, and swelling, potentially by blocking the replication of the virus. More evidence is required, however. Now for pharmacologic therapy. So although oral HSV infections in immunocompetent patients are self-limiting, antivirals and analgesics can be recommended for primary or recurrent infections. Topical protectants are also available to help protect cracking and excessive drying of HSV lesions. Examples of these would be calamine, cocoa butter, or zinc oxide. Analgesics such as acetaminophen, ibuprofen, or naproxen can be recommended to control moderate to severe pain for a period not exceeding 3 days. Topical products containing anesthetics, such as benzocaine, camphor, or lidocaine, as well as menthol, may be useful in relieving mild pain for a relatively short period of time. Now, the last thing to discuss would be antivirals. So several antiviral agents, including prescription agents, acyclovir, famciclovir, and valacyclovir, have been studied for either treatment or prophylaxis of cold sores. Not all of these agents have an official indication for cold sores in general, immunocompetent population, and only acyclovir is indicated in children. 3 different approaches to antiviral treatment may be used. So the first approach would be intermittent episodic therapy. So IET is the treatment of isolated acute episodes of HSV at the first clinical sign or symptom for either a primary or recurrent episode. Evidence supports the use of acyclovir, famciclovir, and valacyclovir. The management of a primary episode requires longer treatment duration, so i.e. 7 days. And recurrent infections are managed with high-dose, short-course antiviral regimens, starting as soon as possible, but are still effective if begun within 48 hours of the outbreak. Compared with acyclovir, valacyclovir reduces the time to healing and resolution of pain more effectively for recurrent infections. The second approach would be chronic suppressive therapy. So CST is not indicated for most patients with HSV infection, but may be appropriate for 5 to 10% of patients who experience frequent recurrences, so greater than or equal to 6 per year, and who also experience disfigurements, have difficulty swallowing or severe pain, have prolonged episodes, or are particularly distressed. Evidence supports the use of low-dose daily oral acyclovir, famciclovir, and valacyclovir. Topical therapy is not recommended for CST. And the final approach for antiviral therapy would be intermittent suppressive therapy. So IST is appropriate when recurrences can be anticipated based on known precipitating factors, particularly in situations where decreasing viral shedding will decrease the likelihood of infecting seronegative individuals. Specific dosing guidelines are not available in IST, but extrapolation of data from CST studies is thought to be appropriate. Oral acyclovir has been shown to have some effect on preventing sunlight-induced recurrences, but data for topical acyclovir cream are conflicting. Alright everybody, that's all we're going to talk about today with the treatment of cold sores. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, most importantly subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.